The first reported case in the Ebola outbreak ravaging West Africa dates back to December 2013, in Guéckédou, the forested area of Guinea near the border with Liberia and Sierra Leone. Travelers took it across the border. By late March, Liberia had reported 8 suspected cases and Sierra Leone 6. By the end of June, 759 people had been infected and 467 people had died from the disease, making this the worst ever Ebola outbreak. As of June 29, 2015, 27,551 cases and 11,236 deaths had been reported worldwide, the vast majority of them in these same 3 countries. The outbreak continues to claim lives, though the casualty rate has abated this year. Liberia was declared Ebola-free on May 9 this year, but routine surveillance detected a new case on June 29 infected from an unknown source. The situation in Guinea and Sierra Leone is improving, with most new cases coming from registered contacts. The World Health Organization reports that each country now has enough treatment beds to be able to isolate and treat patients with Ebola, and to bury everyone known to have died of the disease. The chart above shows numbers from both the WHO's regular situation reports and from patient databases, which tend to be more accurate but are less complete for recent weeks. The rate at which cases give rise to subsequent cases, which epidemiologists call R0, is the key variable in the spread of Ebola. For easily transmitted diseases, R0 can be high. For measles it is 18. Ebola is much harder to catch. Estimates of R0 in different parts of the outbreak range from 1.5 to 2.2. Any R0 above 1 is bad news. The very high mortality rate of the disease, estimated at around 60% in this outbreak, means that Ebola can quickly claim more lives than other, more established killers. Many of the regions in the 3 most affected countries are now seeing a slowdown in the number of infections. Liberia only had a single confirmed infection in one of its 15 counties since March, but as a new case was reported this week, vigilance must be maintained. 8 of Guinea's prefectures have not reported a single confirmed infection since the outbreak began, but the 12 new cases reported this week were from just 3 prefectures. The number of new cases in Sierra Leone has remained steady in recent weeks, with just 8 confirmed in the week to June 29. The map on the left shows the number of days since the last confirmed infection by region for each country. The inadequacies of the healthcare systems in the 3 most affected countries help to explain how the Ebola outbreak got this far. Spain spends over $3,000 per person at purchasing power parity on healthcare. For Sierra Leone, the figure is just under $300. The United States has 245 doctors per 100,000 people. Guinea has 10. The particular vulnerability of healthcare workers to Ebola is therefore doubly tragic. As of June 29, there had been 874 cases among medical staff in the 3 West African countries, and 509 deaths.